So the next topic we're going to cover in neuropharmacology is pain. Now we talked about pain a little bit before when we talked about opiates and the small molecule neurotransmitters and how that affected the action potential and neurotransmitter release and binding to receptors and that signal. But there is more to pain than what we first looked at. And to start our journey delving deeper into pain, we're going to talk about the different types of pain. So the first one is peripheral nociceptive pain, and that's what you have probably experienced before. If you bump into something or you get burnt, that's what we call that peripheral nociceptive pain. So basically it is the activation of nociceptors or pain receptors in your skin, and then that signal gets to the brain so that you can generally remove your hand from the stove, right, or to remove yourself from that painful stimulus so that you don't cause tissue damage. But often we're not fast enough to remove ourselves from that pain, or the damage has already occurred. And so what happens is inflammation or damage in those tissues, and those nociceptors are going to respond and send a pain signal to the brain. Now, one of the things that's good about that is that type of pain responds to those NSAIDs. So if you want to write this down, these are non-steroid anti-inflammatory drugs. So non-steroid anti-inflammatory drugs. And we'll talk about those coming up. And they also respond to opioids, which we have talked about before. So some of the general non-basic damage things that can be examples of this nociceptive pain is osteoarthritis, rheumatoid arthritis, or pain resulting from cancer. But it's also, did you bruise yourself, or did you accidentally cut yourself? Those kind of things. And if you wanted to add the official definition, it's basically that nociceptive pain based on that nociceptor activation, that is activation of pain receptors of the body. Another type of pain is neuropathic pain. And as not as many people are familiar with this, but some people may be. But that neuropathic pain, it's based on damage to the nervous system. So something happened to the nerve, so it can be a crushed nerve that's in the peripheral nervous system, or there might be a lesion in the brain or the spinal cord in the central nervous system that might be leading to that pain. So if we go back up here and look specifically at that peripheral neuropathic pain, that's damage to or something going wrong in those peripheral nerves. And this type of pain, you can, again, there are pharmacological therapies that are going to work. They can either act in the periphery or they can act in the central nervous system, because if it's in the periphery, then that signal has to get to the central nervous system. So if you are trying to, fix it from the periphery or centrally, it's going to work. And examples of those types of pains are diabetic neuropathic pain. So do you have damage to the nerves? There's also, after a herpes infection, so post-herpetic neuralgia. So the damage the virus does can cause damage to the nerves. And another one of these is that you could have a crushed nerve. So we can also have central neuropathic pain. So again, that nociceptive pain was damage to tissue. Neuropathic pain is damage to nerves or the brain. And there's the peripheral is damage to the nerves. The central is damage to brain regions. And when there is that damage, then the idea is that the pain is not processed correctly. And the difference here is that if you're going to treat this, it has to be a centrally acting pharmacologic therapy. The peripheral therapies don't work when the source is in the central nervous system. And sometimes there is positive response when you're talking about therapies that are not pharmacological in nature. So maybe exercise or cognitive behavioral therapy may help a little. But fibromyalgia is one of the ones that it has a really big question mark of how does it happen, what's happening to cause it. Irritable bowel syndrome is another one. And these are very often chronic examples of chronic pain. And there are often combinations of peripheral and central mechanisms that either are inflammatory and mechanical damage to the tissues and dysfunction in the central pain processing. So one of the things is that these are more difficult to treat. Low back pain is one of the things that caused the opioid epidemic, because it was the issue that the pharmaceutical company that was marketing opioids or opiates for long-term pain relief, they mainly targeted individuals with low back pain. So that larger umbrella of neuropathic pain can actually be caused by many different things. So some kind of traumatic injury to the brain or spinal cord, specific diseases that are going to cause effects for the brain or spinal cord, infection, and then you get to specific diseases in terms of cancer and other type of genetic disorders. So these are some causes for pain. And in the next video, what will look like is, well, what neurotransmitters are involved in this and how can we modulate those pain signals pharmacologically.